Hi, what brings you into the emergency department?
My daughter was riding her bike and she fell. So I think something is broken. She said it's hurting a lot.
Okay, let's go ahead and get you into the system.
As a triage nurse, we want to get their name, date of birth, and vital signs. It is important that we also obtain an accurate height, weight, as pediatric medications are dosed by weight. We also perform a sample assessment, which are signs and symptoms, allergies, medications, PMH, last oral intake, and events leading up to.
So, how did it happen?
So I was rollerblading and I kind of fell and I felt weird and I landed on my left wrist
Okay. Can you point to where it hurts?
right here.
Okay. Using this, how much would you say it hurts?
Mm, 7.
For children, rating their pain can be challenging. That's why we use the face assessment. They are able to point to the face that feels most similar to how they feel.
Okay, so let's try to not have your arm move. Let's keep it immobile, and we'll get you back to your room.
When a child is being seen for an injury, an assessment needs to be completed for physical abuse. Observations of the caregiver should include emotional support for the child, attentiveness to the child's needs, and concern for their injury. As you see here, the mother is appropriately comforting and attentive to the child's needs.
Hi, I'm Nadine and I'll be your nurse today.
When entering a patient's room, we need to wash our hands, identify ourselves, identify the patient, and provide privacy.
So, what brings you here today?
We think she broke her arm.
Do you know how it happened?
I was rollerblading and I fell. I tried to catch myself, but I landed weird and now it hurts a lot. Sorry, I need to make a phone call so I can tell my work I can't make it.
Okay.
As a nurse, we must be able to provide a private time and place for the child to answer abuse related questions, avoid using any leading statements, and determine their immediate need for safety.
Do you feel safe at home?
I
Did
feel-
anybody hurt you?
I feel safe. No one hurt me.
All right, so I'm just going to take a look at your arm again, okay?
During assessment, we assess the 6Ps: pain, pulselessness, pallor, paresthesia, paralysis, and the temperature of the injured area. This is the start of the nursing process.
Okay, so I'm going to tell the doctor and she'll be in shortly. Is there anything I can answer before I go?
No.
Hey doc, do you think you can take a look at the patient in room 4? What's going on?
While performing an SBAR, we ensure effective communication. We state the scenario, background, assessment findings, and recommendations. This is the D and the P of the nursing process.
So I did an assessment and it's really consistent with fracture. The patient's been complaining of pain and she can't move her left hand and I'm worried about the impaired circulation. Is it okay if we can get her pain under control and maybe some x-rays? And if you can just see the patient right now, doc?
Okay, I'll go ahead and order those x-rays. I'll be right in. Can you start an IV on her?
Okay, thank you, doc.
Hi, I'm Dr. K. Does she have any allergies?
No drug allergy.
Okay, Nadine, I'll be ordering IV morphine. Do you have any question or concerns?
No, doctor. Thank you so much.
Okay. Hi, so the x-ray came back and you broke your wrist. So we're going to put a splint until you see your ortho specialist who will put a cast on. Okay?
This is the E of the nursing process. We evaluate the outcomes of the interventions, pain, and repeat physical assessment findings, determine if a change in the nursing plan is needed.
Now that you're feeling a bit better with the splint and the pain meds, we'll go ahead and discharge you. Nursing management includes education for both parents and patient. You want to educate family about 6Ps and how to assess them, like capillary refill tests, temperature, and color, including information about promoting ROM exercise, maintaining proper alignment, and keeping pain under control.
And that's all, folks.